Hello and welcome. Today we're diving into a fascinating and often misunderstood condition that can leave you feeling off balance and disoriented: cervicogenic dizziness. It's a type of dizziness stemming from a problem in the neck, and in this video we'll explore what it is, what causes it, how it's diagnosed, and what can be done to manage it. Let's get started! So, what actually causes cervicogenic dizziness? The root of the problem lies in the upper cervical spine. That's the neck area near the base of your skull. The most common causes include neck injuries like whiplash from car accidents, arthritis in the neck joints, poor posture sustained over long periods, muscle tension or spasms in the neck, and even nerve compression in the neck. Any of these issues can disrupt the normal flow of sensory information from the neck to the brain, leading to dizziness. Now, let's talk about how this actually happens in the body, the pathophysiology. The neck is full of proprioceptors. These are sensory receptors that tell your brain where your head is in space. When there's a problem in your neck, an injury, muscle imbalance, or joint dysfunction, these proprioceptors send inaccurate or distorted signals to the brain. The brain then struggles to reconcile this conflicting information with input from your eyes and inner ear, which are normally responsible for balance and spatial orientation. This mismatch results in the sensation of dizziness, unsteadiness, and disorientation that characterizes cervicogenic dizziness. Understanding how common cervicogenic dizziness is can be tricky. That's because it's often misdiagnosed or lumped together with other balance disorders. Current estimates suggest it accounts for a significant percentage of dizziness cases, particularly those arising after neck injuries. It affects people of all ages, but is more commonly seen in adults, especially those with a history of neck trauma or conditions like arthritis. More research is needed to pinpoint the exact prevalence in the general population. What does cervicogenic dizziness feel like? The primary symptom, of course, is dizziness, but it's often described as a sense of imbalance, unsteadiness, or lightheadedness rather than a spinning sensation, which is more characteristic of vertigo. Other common symptoms include neck pain and stiffness. Headache is often originating at the base of the skull, reduced range of motion in the neck, sensitivity to light or sound, difficulty concentrating, and even nausea. Importantly, the dizziness is often triggered or worsened by neck movements or sustained postures. Diagnosing cervicogenic dizziness can be challenging, as there's no single definitive test. Doctors typically rely on a combination of a thorough medical history, a physical examination, and specific diagnostic tests. The physical exam will focus on assessing your neck range of motion, posture, and muscle tenderness. Neurological tests are performed to rule out other potential causes of dizziness. Diagnostic tests like MRI or CT scans of the neck may be ordered to visualize the cervical spine and identify any structural abnormalities. Specialized balance testing may also be conducted to assess the function of the inner ear and balance system. While there aren't official classifications or specific types of cervicogenic dizziness besides severity levels mild, moderate, severe, it can be helpful to think of it as being related to the underlying cause. For example, you might have post-traumatic cervicogenic dizziness after a whiplash injury, or arthritic cervicogenic dizziness if it's linked to arthritis in the neck. The good news is that cervicogenic dizziness is often treatable. The focus is on addressing the underlying neck problem that's causing the dizziness. Common treatments include physical therapy to improve neck range of motion, strength, and posture. Manual therapy techniques, such as massage and joint mobilization, can help release muscle tension and restore proper joint function. Pain medications and muscle relaxants may be prescribed to manage pain and muscle spasms. In some cases, cervical injections may be used to reduce inflammation and pain. Importantly, addressing contributing factors like stress and poor posture is crucial for long-term management. While it's not always possible to prevent cervicogenic dizziness, especially in cases of accidental injury, there are things you can do to reduce your risk. Maintaining good posture, especially when sitting for long periods, is essential. Regular exercise to strengthen your neck and back muscles can also help. If you're involved in activities that put you at risk of neck injury, such as contact sports, be sure to use appropriate protective equipment. And if you experience any neck pain or stiffness, seek medical attention promptly. The prognosis for cervicogenic dizziness is generally good, especially with prompt and appropriate treatment. Many people experience significant improvement in their symptoms with physical therapy and other conservative treatments. However, it's important to be patient and consistent with your treatment plan. Recent research has focused on developing more precise diagnostic criteria for cervicogenic dizziness and on evaluating the effectiveness of different treatment approaches. Studies are also exploring the role of sensorimotor training in improving balance and coordination in people with this condition. As we learn more about the underlying mechanisms of cervicogenic dizziness, we can expect to see even more effective treatments in the future.